Hello everyone, and thanks for joining our presentation on sudden infant death syndrome, also known as SIDS. Here we're going to be talking about what SIDS is. Later we're going to discuss the prevention of SIDS as well as some of the risk factors of SIDS. And I'm also going to discuss the prevalence of how often it occurs in the population. First, SIDS is defined according to Priscilla, Foster, Holbrook, and Jeffrey, as the sudden and unexplained death of an infant under the age of 1. Even with a complete autopsy, the cause of death is usually not able to be determined in a case of SIDS. SIDS is a worldwide problem and occurs about 0.2 to 3 cases per 1,000 live births. SIDS is the most common cause of death in infants under the age of 6 months of age, which makes it a very pressing issue if it is the primary cause of mortality in children. There is approximately 3,700 cases of SIDS in the U.S. alone per year. However, there has been recent evidence to suggest that there's been a decrease of about 50% following the success of campaigns like Back to Sleep that promotes parents putting their children to sleep on their backs. Later, you're going to hear more about some of the risk factors for sudden infant death syndrome, which include things like low birth weight, overbundling, bed sharing, and young unmarried mothers, as well as a lack of prenatal care. There are some preventative or protective factors that will be discussed in length later, like room sharing, breastfeeding, and pacifier use. It is thought that SIDS is a pulmonic issue where the child stops breathing in their sleep, and typically there are lots of different theories on what causes SIDS at the moment. Some people claim that it could be a sleep apnea problem. There are more people that think it could be a genetic consideration, such as the mutation in several genes that are associated with SIDS, like cardiac ion channel genes that cause issues with the body telling you when to breathe.
One of the risk factors for SIDS is low birth weight. Infants who are born small for their gestational age are at an increased risk for SIDS. Preterm babies are also at a higher risk for SIDS than term infants. Among low and very low birth weight infants, the rate of SIDS has consistently been 3 to 4-fold higher than in infants who have made it to term. Along with low birth and preterm babies at risk for SIDS is when they have respiratory problems. Babies who already have a hard time breathing do not need anything else to make their breathing any harder. If the family has a history of apnea or other impaired respiratory function, it likely falls within the final common pathway of many of the proposed mechanisms for SIDS. Another risk factor for SIDS is when the baby sleeps on his or her stomach. Babies who are unaccustomed to laying on their stomach are at an increased risk for SIDS. It is better to let them lay on their backs to sleep. Traditionally, concerns that supine or on their stomach positioning of premature infants may reduce oxygenation in premature infants are measured by peripheral pulse oximetry. However, 2 small studies have suggested that this may not be the case, at least among infants who are older than 32 weeks post-menstrual age. The importance of having premature babies lay on their back demonstrated in a population-based case control study in England, where the parents of 325 SIDS cases and 1,300 age-matched control infants were interviewed. In multivariate analysis, infants who were born small, younger than 37 weeks, and weighing less than 2,500 grams were 5 times more likely to die of SIDS than in infants who were born at term or weighing more than 2,500 grams.
Here are some images. On the left, we have proper placement to prevent SIDS. And on the right, we have some of the don'ts, things that should be avoided as potential risk factors for SIDS. Of special note on the left is how you should always be around when you have pets near your children, especially younger than the age of 1, in case a dog or cat sits on the infant.
There are many different ways to prevent SIDS. First off, starting with pregnancy. Good prenatal care lowers the risk of SIDS because a term baby is more likely to live past infancy. You should also not smoke during your pregnancy or use cocaine, heroin, or any prescription drugs not prescribed by your doctor because that can increase the risk of SIDS. Ways to prevent SIDS after the baby is born includes not allowing anyone to smoke around your baby and not exposing your baby to secondhand smoke in a room or a car. Allow your baby to use a pacifier when it is sleeping. According to Bilio, this helps prevent SIDS because of the bulky handle that sticks out prevents the baby from being directly on its face when the baby rolls over on its stomach. You should also give your baby plenty of interactive tummy time. That helps the baby to build its muscles up, and if they can roll over, they're less likely to die from SIDS. According to Mary Beth Adams, a nurse practitioner at St. Catherine's Healthcare in Belgrade, the recommendation that hospitals and at her clinic are to follow the ABCs. The ABCs are the baby should be alone on their back in a crib. When traveling, be sure to have a place for your baby to sleep so that it isn't sharing a bed with you. That'll help reduce the risk of SIDS. Talk to your pediatrician if your baby has periods of not breathing, going limp, or turning blue, because that can also be part of SIDS.
Here are some additional preventative interventions that are discussed in our Maternal Child and Nursing Care book by Perry, Loudermilk, Cashin, Alden, Wolshansky, Hockenberry, Wilson, and Rogers. Infants should be placed in the supine positions of sleep during the first year of life to prevent sudden infant death syndrome, also known as SIDS. Infants should lie on a firm surface, specifically on a firm crib mattress covered by a fitted sheet. Soft materials such as bumper pads, comforters, quilts, pillows, sheepskins, or stuffed toys should not be placed in the crib. Room sharing, but not bed sharing, is recommended during infant sleep for at least the first 6 months and ideally for the first year. Bed sharing can increase the risk for suffocation and falls. Infants may be brought into the parent's bed for comforting or for breastfeeding, but should be returned to the crib or bassinet before the parent goes to sleep. Parent education prior to hospital discharge should include specific information about safe sleep practices. The Safe to Sleep campaign from the National Institute of Child Health and Human Development provides materials for healthcare professionals and parents. The educational resources are designed to reach culturally diverse audiences with messages about promoting a safe sleep environment and preventing SIDS. Anatomically, the infant's shape, a barrel chest and flat, curveless spine facilitates the infant to roll from the side to prone position. Therefore, the sideline position for sleep is not recommended. And also, according to Somers and Nursing Central Diseases and Disorders, room sharing is recommended, and it is also recommended that the infant is not overbundled.
Just a minute. I'll be right there. All right, I'll be right back. Coming.
Hello. My name is Catherine. I'm going to be your nurse today. I'm just here to do your 1 month checkup with you and your baby. How are things going with you and your baby?
Things are going really well. The kid doesn't, it's really hard to get him to go back to sleep. Like he just kind of cries, and so I'm having a little bit of issues with nighttime.
Okay, can you explain to me how like your bedtime routine with him?
Generally we try to do a bath after feeding and whatnot. And then we maybe just sit down and have some like quiet time. And then I go ahead and I put him to bed. And then, I don't know, maybe like a couple hours later, he's just screaming, just so unhappy. And it happens every 2 hours throughout the night.
Okay. So, how do you like lay your baby in your bed? I see that he's on his stomach.
That's the best way he sleeps.
Okay. So we actually, like according to like all of the hospitals and research, you actually don't want your baby to be sleeping on his stomach. So I can show you some ways to place him on his back into the crib, just because that helps prevent SIDS, which is sudden infant death syndrome.
Oh my goodness, I've never heard of that.
Yeah, it happens with babies like younger than like 6 months because of like co-sleeping or sleeping on its stomach with a whole bunch of padding. So I can just show you some ways to put him to bed just to have it be more safe.
All right, okay, sounds great.
All right, so So first we'll take out all of the padding, and you just want a firm base like you do under all of this, all these blankets and things.
What if he gets cold?
So actually, I'll show you a method on how to swaddle your baby, and if it seems too cold in the bedroom or if he's not sleeping because it's too cold, you can turn the temperature up in his bedroom. So I'm going to show you how to swaddle your baby into a blanket. So if you just kind of fold down the corner like you did, you'll bring up the bottom, the top, and kind of fold it so it doesn't get into his face. And you want to keep his arms down by his side and bring over this side. You can roll him over and tuck that corner under, and then you just bring this over. That's how it's supposed to look. So then he's all, with nothing like in his face or covering his nose or mouth. And then you can just lay him in his back into there. And then you also just want to make sure you don't have any bumper thing in your crib, because if he rolls and like gets his face into it, then he can't breathe as well.
Okay, what about like, he has stuffed animals that his granny gave him. I just haven't brought him in yet. Would that be something that I could stick in here to where it would keep him safe from not hurting himself along the sides?
We usually advise against it until he's a little older, just so that he can maybe like grab it or anything, or like maybe like push it away so it's not in his face. But yeah, so maybe wait till he's like a little older.
Okay.
And then I was just wondering, do you smoke around your baby, or do you usually do it outside?
I smoke in the house.
Okay. So we actually recommend, or it's recommended, I should say, that you don't usually smoke around your baby, just because then it prevents the SIDS.
Okay.
Because that is a big high risk factor. So
But smoking outside is fine.
yeah, and then you just don't want to, or we prefer, it's best if you just don't smoke like at all, just because then all the secondhand smoke with your baby. But if you do need to have smoke, we recommend doing it outside.
Okay. All right. Is there anything else that I could do possibly to make sure that Nikki is safe?
Do you have any questions though?
I don't, but at this time I've learned so much. I've learned swaddling now, no smoking, keep toys, jackets, blankets,